It's my outfit. Okay. Oh, okay. Hi everyone. Good evening. Good evening. Good evening. I let me know if you can hear. Let me know if you can hear me, please. Good evening. Welcome to El Talk with Kemi, and most importantly, welcome to the live session on marriage compatibility. And today, I'm super excited. It's just like I'm ready to share. It's just like I have a lot of things to say today, both to married couples, unmarried couples, in a relationship, even if you are single or in a situationship as well. Have a lot to say this evening. So, good evening. Let me know where you're connected from, and if you can hear me, I would love to see the comments coming in. If you can hear me loud and clear, sorry, if you can hear me loud and clear, let me know where you're connected from tonight as well. Good evening. Welcome, welcome. Please share the link to everyone as well. Wherever you joined in from, I believe that you got the link. Please share the link to everyone. Post in your WhatsApp status, Facebook, Instagram, everywhere it needs to be shared. And let's just spread the word that the marriage compatibility session is live and it's on YouTube right now. So can we do that real quick? Why you just type out where you are connected from tonight. I would love to meet everyone as well. Good evening. Good evening. Hi, good evening. Hi, Samuel. Nice to meet you. Thank you for joining in. Nice to meet you. Good evening. Thank you for being here. Please kindly share the link as well. We are live. We are live. We are live. So we can get into tonight's session without wasting too much time as well. All right, I'm just waiting for people to join in before I start. So let's go on a short commercial break. So ensure you just keep sending the link to people as well. Why? We are live. We are live. We are live. We are join me. All right, thank you. I see someone else joining already. Good evening. Please type out where you're connected from tonight. Good evening. Good evening. Please type out where you're connected from tonight. Good evening. As we go into the session for today, Welcome to Health Talk with Kemi. We are a global YouTube platform. I'm starting to have global to the platform. All right, we are a global health platform, and we stand to empower both men and women concerning their health and to help them make informed decisions about their health as well. And we have live sessions like this, and you can go through our YouTube page to check all our videos, watch, and I assure you that you would learn a lot as well. And tonight I'll be talking about marriage compatibility. And I choose to talk about this topic because really yesterday was World Sickle Cell Day, and I'm sure you must have seen people posting happy Sickle Cell Day, World Sickle Cell Day. And somehow I feel that there are things that can be avoided if we put in the right measure, right? Because God is not wicked. I've had people say, yeah, why did God do that? God is not wicked. And I feel like it's we humans that are wicked. No offense to anyone, but if you put in the right measures, there are some things that would actually not happen on earth. And so that's why I just feel it's very important to talk to people about marriage compatibility. The fact that you love someone does not mean that you both need to be together. There are some relationships that needs to be broken, dissolved, set apart. You know that we cannot be together because this relationship is not good for your future. And when I talk about future, I don't mean just you and your baby, just you and your husband. I mean you and your children, right? You don't want your children coming to the world and then they start going through traumas that they didn't ask for or that they didn't ask to go through, but simply because their parents said they loved each other, then you put them through it as well. So that's why tonight I said I will tell everyone about what you need to know about marriage compatibility, right? The test you need to do before you say I do to your loved one, the particular process you need to go through as well. And I think that is going to be a session of empowerment for everyone that would listen tonight. So I would bring up my slides shortly so we can just get into it proper and move on as well for tonight for tonight's session. Okay, let me know if you can see my slide, please. The slide is up now. Just let me know if you can see my slide. Marriage compatibility. Let me know if you can see the slide at your end as well. Marriage compatibility. You can see. So just take, for example, that this is the woman, this is the man. So it is the man preaching to the woman this time or educating the woman this time, right? And the first thing or what we'll be talking about tonight are introduction, the importance of marriage compatibility. We'll also talk about genetic compatibility. We'll talk about infectious disease screening. We'll talk about chronic health conditions. We'll talk about chronic health condition and also reproductive health and fertility. So these are the subtopics that will be discussed tonight. And I'll just love that you listen and also ask questions. Para at the end of tonight's session, you can also ask. Sorry about the persistent cough. You can also ask questions that will be clarified and discussed as well. So moving on, the first thing we have is introduction. So introduction, we'll talk about benefits of premarital screening. Benefits of premarital screening. And before I talk about the benefits, I want to talk about marriage compatibility. Marriage compatibility simply means two people are compatible or after undergoing several tests, they've been proven to be compatible to spend their lives together or to say I do to each other. And I think I want to use very simple terms tonight. It means after you've gone through a series of medical tests, you both have been proven compatible to spend the rest of your life together. It simply means each wife or the husband, you are free from infectious disease, you are free from genotype, wahala, and you both can do life together. That's what I call marriage compatibility. So it means when you go through some medical tests, and then maybe your wife comes back as SS and you are SS, you already know that we are not compatible. So it's at that point that the love was, the love of the eyes of love is supposed to be open. We say that love is blind. At that point, love eyes should be opened, and then you tell yourself, no, we can't be together, and not just say let's. One thing that is a major problem here in Nigeria is sometimes we suspend our human, should I say, we suspend our human minds and just make everything spiritual. You know that you and this person, medically some things are not right, and then you say, you know what, God will do it. Have you ever had stories like that of couples that said God will do it, we trust God, then they start praying and putting anointing oil on their head? This is not, I'm not saying God does not do miracles, because God is God, but there are some things that you just know that these things are not right. Before your eyes, you can see it's not right. And then that's the best time to call it off and say, you know what, I love you, but let's do what's best for our future. So this is not a matter of anointing oil, running to pastors, pastor, pray for us. What can we do? What can we not do? It's a matter of you using your head, or your brain, and saying, oh, the doctors have counseled us against this thing. Don't let us do it. So please, I sincerely hope that no one here would do the Nigeria mentality. And wherever you are watching me from, when you know that this thing is not good, please don't go ahead and do it. And don't say you pray and use anointing oil. And don't get me wrong, my God does my God does miracles, right? But there are some things that are just, you know what I mean, just you thinking and reasoning about it as well. So now let's go to the benefit or importance of premarital screening. So why should you and your husband get yourself, or boyfriend or fiancé, get yourself tested medically before saying I do, before getting married to such a person? Why should you test yourself medically? Now, the first reason is informed decision making. When you take medical tests, right, you'll be informed as well. Okay, this is what it means to be compatible. You would know, you would know what is going on with both of you as well. Now, you will also be informed to make decisions concerning your health. Now, when you go for premarital screening, and then a doctor or a nurse or any medical official counsel you and say, you know what, I think this thing is happening to your wife. Now you would know. So you know how to bear with your wife. You know how to bear with your husband. You know how to live together. So it will not come to you as a surprise that, oh, I didn't know. You will know. And that's why we recommend premarital screening. Get yourself tested. Go along with, one thing youth like to do, and I sincerely hope that it's not all youth. It's, when the guy is giving them money, it's as if our eyes are closed. Women, open your eyes, so because it's as if our eyes are closed once money is coming in. That's why I hear people saying, once there's money in the relationship, get married. I do not agree. Money is good, love is good, but also to prevent to prevent future nursing of different things that could have been avoided, I beg of you, go for premarital screening. So when you go for premarital screening, you would have better choices. You would know what's going on. Oh, I think you have this particular disease, and I think that this is the way you both can manage it if you still want to be together, if you still want to proceed together to be in a couple. Then the second importance of you going for premarital screening as well is preventive health care. So you will know what is going on. You'll be able to, there are some, should I say, there are some diseases that are not really severe. Then when you know that you have it, you'll be able to prevent, you'll be able to, should I say, act on it. And then it can be prevented from getting worse, right? So there are some things that when you go for premarital screening, they will find out and say, oh, I think you have low blood, low sugar level, high sugar level. Now they'll tell you, take this, don't take that, eat this, don't eat that. Now that will also help you to prevent any, shall I say, any complications that might come with this particular health condition. So one of the benefits that I tell people, go for premarital screening, because you also have preventive health care. You'll be able to prevent what you can prevent while it's still in the very, should I say, incubator state, before it gets very big and you start nursing something else again. Now, the third benefit of premarital screening is better family planning. See, as much as you want to hide things from people, and in all sincerity, I feel like if you have that heart, and if you have that kind of nerve to hide something as important as medical issues from your so-called partner or to be partner, you are devilish. You can hide any other thing, because I've worked, okay, I'm still, a nurse, still a nurse in the embryo. But you see, in my years of, should I say, nursing practice, I've seen people that are HIV positive, and then they'll tell the nurses, please don't tell my husband, I don't want him to know. And in my head, I'm like, why would you say you don't want your husband to know? This is someone that you literally see, sleep on the same bed with, do life with. And how would you hide such, should I say, how would you hide such medical issues from someone you call your partner, someone you call your husband, someone you call your future person? So when you go for premarital screening, you will be able to plan your family properly. So you will know if your wife has low fertility issue, you will say, okay, let's work on it together. So it's not a time for you to say, I don't want to be with you, but how can we work on it together as a couple? And that's why I am addressing both the female and the male part. How can we work on it together as a couple? Now you say, okay, we have to start taking drugs. Maybe in the first years of our marriage, we will not, we don't want to get pregnant. Maybe in the first 3 years, we don't want to have babies. Maybe in the first 4 years, we want to focus on treating. Do you understand? So when you go for premarital screening, you would have better idea about your health, about whatever is going on or whatever is already existing as a condition, even before you are, even before you get married. Now you'll be able to treat it. You'll be able to prevent some things from happening, and now you'll be able to plan your family well. You'll be able to now you'll be able to make informed decisions, because now you've been empowered about what's going on with you and your health. So you plan better from there. So premarital screening also helps in better family planning. It helps you to take charge of your health, and also take care of yourself too, and also help you and your husband, or you and your wife, make better decisions. Then it strengthens the relationship. That's the fourth most important benefit of premarital screening. It strengthens your relationship. Let's take a look at the example that I said earlier. You are HIV positive, and then you are begging the nurses to not tell your husband or wife because you don't want them to know. Now, when they find out, do you think they'll just say, "Oh, honey, it's good, it's fine"? Even I will not say that. If someone hides that kind of thing from me, I will not just say, "Oh, honey, it's fine." It cannot be fine, because that is breach of trust as well, right? Because I trust you. You're my wife. You're my partner. We are doing life together. Now you have this existing condition that is not only a threat to you, but also a threat to me, because these are infectious diseases. It's also a threat to me, to our unborn children. And then you tell people to not tell me. That's dangerous, and that's also devilish. So one benefit of premarital screening is that it also helps to strengthen the relationship. Now, when you and your partner are very open and sincere with each other, you know that, okay, this is what is going on, this is what is happening. So you'll be able to help each other, hold each other by the hand, hold each other accountable as well, in your journey of being married together. So these are the four benefits of premarital screening. It also, the first one is it helps you to make informed decision making. Second one, preventive healthcare. Third one is better family planning, and the fourth one is also strengthens the relationship. And there is one particular question that I cannot forget. My lecturer asked me in school. She presented a case to us, and then she said, if you are a nurse and you are working in a hospital, and one of your clients comes in as maybe HIV positive, and then she tells you, don't tell her husband, what will you do? And that day, I remember saying, I will tell the husband. Not like I'll go and tell the husband directly that, sir, your wife is positive. But I will also encourage the wife, please tell, these things are, it's not, I don't want to say deadly, but these things are very, very risky. Right? It's risky because you and this person would have sexual contact. You and this person would have any contact that would involve sweat or blood. So I beg you, be very open, be very honest about your relationship. If you feel like there is something that runs in your family that you feel like you want your husband, even if as believers, right? We are children of God, and then we just pray it will not happen. Let your husband know. Be very clear and open with anyone you are going to spend the rest of your life with. It will help you and also strengthen that relationship as well. So I think I've done justice to the benefit of premarital screening, why you should get yourself tested, and the importance as well. Now let's go proper into genetic compatibility. Now let's talk about genetic compatibility. Genotype is the specific makeup of an organism, and I believe that everyone can see my screen as well. Genotype is the specific makeup of an organism. It is the blueprint an individual inherits from their parents. Now, it simply means that your genotype is simply based on your parents. And that's why I'm talking to future parents, existing parents, non-existing parents, and parents that will still exist as well. Because now your genotype or your children's genotype is dependent on you. Now, your own genotype is as a result of your parents coming together. And God is so good, because I would say, back then, it's not as if our parents used to do all this, shall I say, test and all. But things have changed from then to now. And that's why the many cases of sickle cell that we have or that are existing right now would have been reduced if our parents or foreparents or grandparents did all the medical tests. But thank God for technology, thank God for awareness, thank God for health as well, and everything just keeps getting better. So I don't want us to dwell on the past. So genotype is the specific makeup of an organism. It is the blueprint an individual inherits from their parents, right? And now we have different types of genotype. We have the AA. Now, your blood group is not your genotype. That's quite different. For your blood group, you see AB positive, negative, O positive, O negative. And the only way you would know this thing is by what? Go and do a blood test. Go to a lab, go to the hospital, let them run a blood test for you so you can know your blood group and your genotype as well. So we have different genotypes. We have AA, those ones are the general, president general. They are the ones that feel like they are the masters. Do we have any AA in the house tonight? Those AA people, they feel like they are the masters. Nothing can happen. We can marry anybody. Their shoulders is always very high, very up. They can marry anybody. Do we have any AA here? Right. So we have AA. Then we don't have there is AA, there is AS, there is SS. The common one that people focus on is SS, Kashamani SS. There is also AC, there is CC as well. There is AC, there is CC. These ones are kind of I don't really want to say rare, but they are not as common as the AA, AS, SS. But there's AC, there is CC as well. I think there is ST too. Yeah. there is ST as well. So these are different genotypes that are existing. Now, the major one that people hear is AA. Let me tell you something. If the only time that your blood test was done was when they gave birth to you, and your mommy say, we did it for you now. That time you were small, it's AA. Go and recheck, go and retake, go and redo any of the English that speaks well to you. Go and retake your blood test, and so that you will know. So you will not just base your genotype on what your mommy told you when they gave it to you 25 years ago. Go and recheck before you get married, or even before the married thing. Go and recheck, so you'll be sure. Because I've had cases of people that their parents said they're AA. When they went to do test, they said AAs. I think I read a particular story on Instagram. So the guy had been saying it's AA, the guy is AA. You were happy. Or those AA are very proud set of genotype people. And they say, oh, AA, we can marry anybody, because he felt like he was AA, and just felt like, okay, our relationship is good to go because I'm AA. Lo and behold, they did that test and it came up as AS. Now, that kind of person, they are the ones that will fall into Holy Spirit will help us, because they've come too far. And they will tell you, oh, baby, we cannot go, baby, I cannot leave you, because baby will not want to leave his baby or our baby. But, at that point, if they know what is good, and if they really go for the premarital screening, an experienced person will say, I advise that you do not go ahead. But that's why I'm saying sometimes, if the eyes of your love is not open, you will make wrong decisions. You will. And that's when you start saying, God will help us. We can have just 2 children. The funny thing is, I'll talk about I'll talk about the chart as well. The funny thing is, everybody will start drawing the tree. Okay, AS, let's cross. The first child will be AA, second one will be AS, third one will be. Sometimes it does not work that way. In fact, the first child can come as AS. Like, this is genotype, so nobody can be precise, or nobody can predict and say, okay, because I'm AAAS, our first child will be AA. It does not work that way. The first child can come out and be AS. You are not God, and you are not the one doing all the genotype, right? So it's just very important that you check again. If as the boys say, I love you, I want to be with you, yeah, bring us your medical evidences. Let's guide them together. Check your own, check my own. So we'll know if we can be on the same page as well. Right, so we have AA, which are the president general. We have the AS, there is the SS, which we are trying to prevent. And I believe that if everyone or everybody is making use of their platform to talk about SS, educate people, and people are doing the right thing, we would have a reduced number. I'm not saying SS people are in trouble, but somehow SS, I don't want to say they're in trouble, but should I say the crises, the pain, the medical, should I say, the medical burden that comes with SS is quite a lot. It's quite a lot, and I really believe that no one should have to go through this kind of pain when it can be avoided. When I was a student nurse working in the pediatric medical wards, there were two particular children that they knew me, I knew them, because they were always recurrent admission, and I felt bad for both the children, the parents, because even the parents, the medical body, the children, the pain, it's just quite a lot. And I really feel that if everybody is using their platform to educate people, to make them know that this is what it should be, what should not be, it will get better. And if people would not be ignorant, and I'm saying, let the eyes of your Lord be open. If they will not be ignorant as well, sorry, pardon me. If they will not be ignorant as well, it will help matters. So for the AC, please don't get it wrong. The ACs are not C class, right? It's just that they have the hemoglobin C, right? And the CC as well. They're also not sickle cell. They just have the hemoglobin CC as well. But AC, now let me just quickly talk about the importance of knowing your genotype before I talk about the compatibility chart. Why should you know your genotype? I think I already mentioned that is important. So you know if you and your baby can go ahead or if you cannot go ahead. Please, I beg you in the name of God, before you say yes to anyone, before you say you want to marry anyone, think about the future. Marriage is a long life contract. It simply means when you get into it, you're telling yourself, okay, we are journeying together, we are working together. You know how people take oaths on the is it oath of vow? I'm not married yet, so that's why you know already. On the altar, and they say till death do us part, blah 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 blah. See, there are some things that, oh God, there are some things that some people cannot survive. Not because I don't love you. That's why I'm saying love is not enough. Not because they don't love you. But imagine going through a lot of ups and downs. Can we not just forget it and just move on? So love will not always be enough. So it's important to know your genotype so you can know if you can proceed with this person, you want to do life with this person as well. Now let's talk about the compatibility chart and risk associated with each genotype as well. You already know, I mentioned earlier that AA are the generals. They can get married to anyone. If you are joining in, welcome, good evening, welcome to Marriage Compatibility. Could you please leave a message so you can tell us where you're connected from and your name as well? Thank you so much. All right, so AA can get married to anybody. If you are AA, you should be proud. They can get married to anybody, right? AA can get married to AC, can get married to AS, can get married to AS. So they have the ticket to get married to any genotype and any class genotype as well. The same thing with AS. AS can get married. Listen, AS, your choice is limited. You can get married to AA. AS should not near AS. I beg you. I'm saying this my word again. Let the eyes of your love be opened. AS should not go near AS. So AS, your only option is AA. That's what I'm saying. AA are the major people now. So if you're AS, your eyes must be looking for AA. Your eyes must be looking for AA person. Now, don't get me wrong. There are some AS that will marry AS and will never give birth to SS. That's what I'm saying. You cannot predict. I myself cannot predict these things. So no one can predict. We are just trying to say to be on a to be on a safe space. No one. Some people will tell you, "Oh, I'm AS, and we don't have SS. We only have AA and AS children." These things cannot be predicted. It's just to help you to be on a safe scale or on a safe space as well. AC should not go for AC. AC should not go for AS. AC should go for what? Just AA. SS should go for AA. CC should go for AA. SC should go for see as I'm laughing, should go for AA. So it simply means that all kind of genotypes should be looking forward to being with AA. And that's why we need to produce more AA, more AA individuals. So AA can marry any class of people. So all genotypes should be tilting towards finding AA. So it means if you are AA, you can marry any class of genotype. You can. If you are AS, your only option is AA. If you are SS, your only option is AA. If you are AC, CC, SC, your only option is AA. You already know why, because I already explained the importance of genetic compatibility with everybody as well. And now I want to talk about rhesus factor because I feel like it's not mostly being talked about. But let me talk about rhesus factor. Rhesus factor is the D antigen that is on the red blood cell. So not everyone has this D antigen. If an individual has the D antigen, we call it rhesus factor positive or rhesus positive. Now, if an individual does not have this D antigen on their red blood cell, we call it rhesus negative. Why is this rhesus factor important, or why is it important for you to know? It's not for the now, it's for the future. Because most times, if a couple is rhesus negative, both the husband and wife, it's possible that their children will be negative as well. But if the father is positive, the mother is negative, if the child, because most times the children or the child inherits their father's rhesus factor. So it means if your husband is rhesus factor positive, it is most likely that your child or your children will also be positive. But if the father is negative, it's also likely that what your children will also be negative. So if you as a mother, if you are rhesus factor negative, that's where problem comes in. And if you are giving birth to a rhesus factor positive baby, problem will come in. Now, let me tell you why. Because your body is trying to fight against your body, against your baby's rhesus factor. Now, for the first time, if a pregnant woman gets pregnant for the very first time and she's rhesus factor negative or rhesus negative, and the baby is positive, for the first time, there will really be no issue, because the only time that the maternal blood and the fetus blood will mix together is during labor and delivery. So at that time, the baby is already out. Now they can give the mother an injection. We call it Rogam. It's an immunoglobulin injection, actually. So they can give the mother injection 72 hours after delivery. That's if she does not know, if she was not aware before that the baby is, positive. So now, since the blood of the mother and child has mixed together, it will send a signal to the body that something strange has entered our system, because this thing was not there before. So something has been introduced. So in response to that, the antibodies in your body is trying to fight against it. Now, the antibodies have registered that this particular antigen is not in your own blood body. So it was introduced. So your antibody is saying that antigen. I said if somebody is rhesus positive, it simply means that they have the D antigen on their red blood cell. So now your body is seeing it as an invader, because this thing is not in our body and is trying to fight against it. Now, imagine that you are pregnant and your baby is positive, you are negative. You as the mother, you are negative. Now, your own antibodies is fighting against that baby, and it will start destroying the red blood cell of the baby, which can lead to anemia, jaundice when the baby is finally born or when the baby comes out to life. But for the first time that you get pregnant, you can take the injection, and then everything will be fine. But at the same time, your body has already registered that something was introduced into our body, and antigen enter the body that is not there before. So if you're not carrying another pregnancy with a positive baby, your antibodies will not fight against your against the baby's red blood cell and to destroy it. And that's why we advise women to know your rhesus factor status, if you are positive or negative, so that you'll be able to take the injection. Now, if you are aware that you are negative, you can take the injection 28 weeks of pregnancy before you put to birth. And now, if you were not aware before, you can take it 72 hours after delivery. I hope that I've been able to explain. But if you are positive and baby is positive, there is no problem. But the issue is with being negative. So you know how to take care of yourself and quickly put the necessary precautions in place as well. Now, what is the impact of sickle cell disease on families? You already know it: the medical burden, the exhaustion, the pain, the stigma. Because not sincerity, people used to stigmatize people that are living with sickle cell because they believe that they have more funny look. They appear thin, they appear lean, their eyes are kind of yellow, and you don't want your babies going through that. Beyond the stigma, it's just always very intense of, okay, this person has to go through pain, take medications, is being admitted, has vaso-occlusive crisis. This person is just quite a lot, and it is not a journey that I would tell anyone to go on, really, because sickle cell is quite a lot of maintenance as well. Now, there are some genetic compatibility that people do not talk about enough. And one of it is thalassemia. Now, thalassemia is simply a disorder of the blood. It simply means that the hemoglobin that the body is producing is not enough. In terms of sickle cell, it simply means that they have abnormal hemoglobin, which means the shape of their hemoglobin is not normal. But for thalassemia, it means that their hemoglobin produced is not enough, and this will lead to their red blood cell being broken down easily. Now, when the red blood cell is being broken down easily, it will lead to blood transfusion. They are always collecting blood because their PCV will be low. then they go back for blood transfusion. It can also lead to organ damage. But these are also tests that people, because I feel like this thalassemia is not always being, spoken about many times. You also need to go through this test. Then albinism as well. Nobody becomes albino by mistake, right? If you check it at the paternal or maternal side, somebody must have had that trait. Now, there's something we call recessive and dominant trait. Dominant trait is the one that is always expressive in an individual. Like maybe if you look at yourself and someone tells you, "Oh, you have your mother's eyes," it simply means that it is your mother's, should I say, color of eye as gene that is actually dominant in you, because every parent has gene that is actually being put together. So now, if both of your parents has recessive simply means recessive might not be the recessive might not show up unless there is a dominant. So if your mother has a dominant gene for black eyes and your father has a recessive gene for brown eyes, the dominant gene of your mother is what you pick, because the dominant will always mask and cover up the recessive. But if both of your parents has a recessive gene for a particular trait, you will see it in you, because now the two of them are coming together and they are giving you that particular thing. That's how you might sometimes that someone is saying, "Oh, you have long legs like your father, you have long hair like your mother." Right? So you see, everybody picks something from their parents. It's either it's dominant or it's recessive. So now for the albinism, it might be that two particular couple, father and mother, has recessive trait for albinism, or there might be like a dominant trait in their father, and then when you come together with that person, now imagine your mom has a recessive trait for albinism, now your father also has a recessive trait for albinism, and now they both come together as one. What will happen? It will become dominant in that particular child. So it's important, please, that you take all these tests before you get married. Now, we also call cystic fibrosis. It simply means that the cells that secrete digestive juices in the body, it is being broken down, and now it will make it secrete very sticky and very thick juices, which can clog the respiratory tract, and it can cause chronic lung infection as well. Can you see that? I said there are many more tests that should be done. I just picked the few that I will talk about tonight. There are many more tests that should be done as well before you say I do. So I think I've explained the genetic compatibility, and I'll move to the next slide now. Now, one of the screening that every couple or intending couple should do as well is what I call the infectious disease screening. Infectious disease screening. It's very important. If a particular person, I don't want to use man or woman, but let me just say one of the couple is HIV positive, you already know what that means, because this can be transmitted to sexual contact, blood mixing together, sweat, body fluid coming together as well. And there's no how. If I live with you, we'll mix together, right? If I get married to you, there's no how you both will not come together. So some of the infectious disease screening that are prevalent, say, in Nigeria, and that everyone needs to do before you say I do to your partner is HIV, hepatitis B and C. Now, I picked B and C because B and C are the most common, and they can be transmitted by sexual contact and body fluid as well. And I also put others into one bracket, which I will talk about now. Now, why should you do HIV testing or HIV test? It's very important, right? So you would know your status. Some people think it's only when you have sex or sexual contact with an infected person that you can also have HIV. It's not like that anymore, right? If there is an if there is an open cut and then your blood mixed with the infected person's blood, obey. Right? You already know what happens that way, or bodily fluid as well, just mixed. And that's why, if you remember, when we were in primary school, secondary school, they would say don't share your blade, because when you share your blade with an infected person and then you have a cut, and the person also, you already know what's going to happen that way. Now they will say don't share clipper, don't share blade, don't share this and that, because these things are very important. So when you know that you're already HIV positive, because I'm just saying these things to educate people, but I know that this has some people's current situation. You might just find out that you are positive and you didn't have anything to do with anybody. I'm just saying that it's not only through sexual contact that someone can be positive or infected. I just shared other means of people being infected with HIV as well. Now, you would know Now you would know how to manage, because there are people that are actually HIV positive and they are in a relationship, they are married, they have kids, but there are drugs that they take. So when you go for premarital screening, the medical personnel would, because I would never mention drugs that anyone would use, so they will tell you the drugs you can use to suppress it, to also still keep yourself healthy so that you can keep on living as well. So you would know how to be able to prevent it, or from transmitting it as well to your husband or to your children, and you'll be able to manage. So it's not as if your husband is just finding out on your wedding night that, how we women can be. And I'm talking sorry, and I'm talking to both the women and men. Honey, I just found out. You did not just find out. You were not just sincere about it. So please, so don't package a strange gift on your wedding night to give your husband or wife and say, baby, I didn't know how to tell you before, but I know that I'm this. Thank you, my mother. Why, you know that I'm this, I'm that, right? So ensure that you do the test. And when you are doing this test, it's either you go with your partner or you go alone and show your result to your partner. But please, no strange news when you both get married together. Now, the hepatitis B and C as well, because they are liver infections that can be transmitted sexually, and it's important to also get tested, right? And I think these tests are tests that you can get done anywhere. I mean, it's not should I say, it's not scarce. It's not scarce. It's not as if it's something that you cannot get done. You can get done in hospitals, centers, health centers. So get tested for hepatitis B and C. And there are also vaccines that are taken. There are also vaccine doses that are taken for hepatitis B and C as well. And other tests that you need to do: syphilis, gonorrhea, chlamydia, herpes, and these are also sexually transmitted infection, right? And I'm sincerely glad that the world is turning to it, let's say, technology world, because now it's like people are waking up and people don't want to bear different burdens in the future. So they're also trying to, take accountability of their health and do the right thing before you say that you want to get married to someone. So these are infectious disease screening, and there are also many more. But I advise, there was a video I put out for publicity for this session, and I said beyond the physical, spiritual, the medical is important as well. So when you go for premarital screening with your husband, fiancé, boyfriend, anyone it is, right? They'll be able to tell you the test that you need to do. I mean, I'm just trying to tell you that beyond just, I've told my pastor, I've told my imam, and this and that, ensure that you also seek like a healthcare professional to put you through. I mean, these things they are very, very important. So you can also, and this does not negate the fact that we are children of God. And people can get so religious and say, but I'm a child of God. That's fine. Everyone is a child of God, but these things are also very important. So we must not suspend our human thinking and just say that I am a child of God. This thing will happen this way. It will happen that way. So ensure that you go for premarital screening as well. And now the next slide I'll talk about is chronic health conditions. I've heard stories of people that say after 1 year of marriage, then they found out that maybe they had diabetes, hypertension, because I listed some of the examples of chronic health conditions. Maybe they had diabetes, hypertension, asthma, autoimmune diseases. But I would also say that everyone should pay attention to your health. Pay attention to signs and symptoms. Pay attention to how your body feels. You see, every sign that you might be feeling is your body telling you something. I promise you. You might see it as just happening at once, but your body might have been giving you different signs. Okay, is this, is that, is this, is that. Now, why is it important to talk about chronic health conditions? You might already have these conditions before meeting your partner or whoever it is that you love and want to be with. That's fine. I mean, no one would say because you have this pre-existing condition, don't get married. But why am I talking about the chronic health conditions? Because it's important for your partner to know about any existing conditions. Don't max these things up and say, I'll be fine, I'll take my drugs in secret, my partner would not know. Let them know. Talk about any existing any existing condition. Let your partner support you, because now you're coming together. So you would carry the weight together as well. Talk about anything that you feel like runs in your family, is going on with you, as symptoms that you are currently feeling. Diabetes, let your partner know. Hypertension, let them know. Asthma. I think I once saw a movie that that girl was gasping for breath. She could not breathe well. No, I think they were on a date, and that girl could not breathe well, and the boy just gave her water, because I mean, what else will he do? He's not a medical professional, he does not know anything. And because she never mentioned to him that I feel like I have this condition, so he couldn't even think about it, that that's what's wrong with her. And then she kept on pointing towards the pause, pointing towards the pause, and he still wasn't getting it. Was like, why is pause the most important thing you need when you are gasping for hair? It didn't get it at all. And then until someone just intervened and said, oh, she's having an attack. And then he was shocked, because the girl never mentioned, because they were like in a relationship, and she never mentioned anything attack. So he was surprised. And that can also lead to a breach of trust, because it simply means, if I want to, should I say, entrust my life with you and do forever with you, I don't think I can tell you this. Now imagine you are finding out on your wedding night that the person you got married to has different health condition that he didn't tell you. How would that make you feel? No one will feel happy. No one will feel excited. No one will feel so good about it. So tell your partner about any existing conditions, so that they can also help you in managing it as well. And so you know how to, shall I say, increase your responsibility. Imagine you're a wife, or you're a woman that is getting married to whoever has different disease, maybe like diabetes. You know that, okay, yes, I have to ensure that my baby takes this, my husband takes that. It will also help you to share your responsibilities as well, either as a wife or husband. And you will know how these conditions can also impact your financial stability. When you know that one of you is nursing a particular condition, you know that, okay, monthly we have to save towards maybe your partner getting his medicine, your partner getting tested, your partner going for his test. You have to, so it's not as if you will enter the relationship and every month 100k is going, 200k is going. You know what I'm saying? If you've watched a Yoruba film, you can relate. You not tell me, I did not know, I don't love you anymore. Then there'll be conflicts. There will be conflicts that could have been avoided if you were sincere from the onset. So it's not as if every month then your partner will come and say, okay, we need to take 200,000 for what? For what? Because now, if they were informed, they would, you would come together. You know how this condition will impact your financial stability, your lifestyle. When your mates are buying Rolls Royce, that's not time to buy Rolls Royce, because you still have a pending condition to take up. And don't get me wrong, if you have the excess money in this world, go ahead. I'm just trying to tell you the importance of the health condition, right? It will also help you to plan your family well. Maybe, okay, for the first 3 years, I think that we should not have kids yet, so we can take good care of ourselves, manage this condition very well as well. So please discuss any existing condition with your partner. Don't let them find out during the relationship. It can break their trust. Yeah. And you don't want being in a relationship where the trust is lost and when you both are not happy with each other, because there are many other things that will happen. And I really feel that some things can be avoided, such as discussing with your partner about any pre-existing condition. Now, I'll talk about male fertility and female infertility. Pardon me. Male infertility and female infertility. I mean, people have seen too many Yoruba movies here. And in the Yoruba movie, you know what is always amazing me and what is always annoying me? Nobody will blame the man for not being able to give birth. It's always the female. Why? It's always the female. That's when you will see all those mothers of the husband come in and say the wife does not have good leg. Have you heard things like that before? The wife does not have good leg. Her leg is not good. When she enter the husband house, the leg did not produce children. And they'll start singing songs for them and making them feel very and making them feel very bad. I want and I really wish that everyone will stop putting the blame of infertility on females. Growing up, I think that's what has been, shall I say, talked about too many times. So if there is no child in the relationship, the woman is at fault. What have we done? It's not only the woman. Infertility can be from both male and female. So it's not only the woman that has the problem of not being able to. Sometimes the woman might be perfectly fine, and it's the male that even has the problem. And I'm sincerely glad that medical, should I say, health is going to a phase where people can get themselves, because before it's just assumption that kills people. Is the female that cannot give birth. Her womb is not good. She has done too many this. Her womb cannot carry children. And it's wrong, because now the problem can be from the male or from the female. And that's why it's important to also test yourself. Now, let's talk about the male infertility. What can cause male infertility? I mean, what can lead to a man or a male to not be able to, should I say, fertilize, or should I say, a male sperm to not be able to fertilize egg? Now, one of the causes I put here is sperm production problem. A man or a male can have low sperm count. Now, if a male has low sperm count and the female is fine, it means the problem is from the male and not from the female. A male can have low sperm count. There can be absence of sperm. But for that absence of sperm, it means there's also an existing condition. And that's why before you get married, I see so many videos online, and then and then, I think I saw a particular video, and that person was encouraging getting pregnant before you get married. So you will know if you and your husband can conceive. And I just felt like, since there are tests that can be done to know if you and your husband are fertile, why should you go ahead to get pregnant before you actually get married? So there can be low sperm count, there can be absence of sperm, there can be poor sperm motility. It means when the sperm cannot move, or when there is an impaired movement of the sperm. Now, there can be abnormal sperm morphology. It means sperm can have abnormal shape. It means if the sperm is supposed to be like a tail, it can have like star shape. That one cannot fertilize any egg, right? That one cannot fertilize, because that one said it will be destroying the egg. You cannot fertilize the egg that way. So there can be abnormal shape for the sperm as well, and all these things would never fertilize a female's egg. Now, one other causes of male infertility can be sexually transmitted infection, right? Like I said earlier, about the infectious screening that every couple should go through. There can be STI, there can be pre-existing STI that can actually cause these things. Now, people think STI just comes about when you have, should I say, unprotected sex with people. Yes, but STI is beyond just having sexual contact with people. And that's why, even if you are using like a general toilet, I beg you, if you are using like a public, like 30 people can use that particular toilet seat in a day, and God so good, you want to use toilet, and then you don't see the need to put like a tissue paper on it or wash it, and then you just sit there like that there too. Things can go wrong. Right? Things can also go wrong. So I also put ejaculation issues, right? So if there are ejaculation issues as well, it can cause male infertility. And erectile dysfunction, in some cases when erection cannot take place, in some cases where erection cannot take place prior to sexual contact or no sexual contact, and you as a male, you will also know that erection is not taking place. Why not check yourself out? Later, it's the female that will be taking all the issues. Check yourself out. So if there's also erectile dysfunction, then something is wrong as well. Get yourself tested. Now, there are also environmental and lifestyle factors that can also cause male infertility. And that's why you must have seen videos such as don't put on tight underwear. Don't put on. Now, the tight underwear issue, research has shown that it can be a cause. Not that it is the main cause, or not that it is the, should I say, top causes, but it can also be a cause of male infertility. Put on loose. Even if you put on underwear, don't make it too tight. Don't put on too tight underwear. Then exposure to chemicals such as lead has been proven as well to cause male infertility. Then eat. Then prolonged use of laptop on the lap. Please, whenever you use a laptop, the laptop always emits heat. If you use a laptop for a long period of time and then you feel like it's hot, it always emits heat. So ensure that you avoid prolonged use of laptop on the lap. Smoking, do not smoke. Obesity or underweight as well can be a cause of male infertility. There are many more, trust me, there are many more that can actually cause male infertility. In fact, there can be there can be genetic defects as well, where there are chromosomal abnormalities. Now, there can be anti-immune bodies when your immune system is fighting against the sperm because it is seeing the sperm as an invader. Do you understand? So there are different things that can cause male infertility. Now let's talk about the female infertility part. For the female part, the three parts of the reproductive system that is always mostly affected for infertility in female is mostly the ovaries, the uterus, and the fallopian tube. Those are the three main parts that are mostly affected when it comes to female infertility. Now, one of the causes is ovulation disorder, like PCOS. You know, PCOS simply means there's a, shall I say, abnormal or irregular menstrual cycle, and there is a dominant male hormone, progesterone, that is mostly dominating in the female's body. It means instead of the female hormone to dominate, the estrogen is like the progesterone that is dominating and masking the estrogen in the female body. Now, this can also cause infertility. But glory to God, you know, I've seen many videos of people on Instagram saying they have PCOS and they're still able to give birth. While some people will tell you with their PCOS, they've been taking medications and they're still not able to give birth, right? And there's also the sort of like thyroid problem. Now, hypothyroidism or hyperthyroidism can also affect the menstrual cycle and ovulation. There's also something that is called hyperprolactinemia, excessive production of prolactin, which is the milk hormone, or which helps in the production of milk, can also affect the menstruation in a female. And hypothalamic dysfunction, when there is a problem with the base of the brain, the pituitary gland and the hypothalamus, it will also affect it will affect the hormones that are needed for the menstruation and the ovulation. Now, there's also pelvic inflammatory disease, such as, you know, we call it PID. People might experience PID. And now pelvic inflammatory disease is actually affecting the fallopian tube. Now, it can make it hard for the sperm to swim to fertilize the egg, and it can also make it hard for the egg to pass down to the uterus. There's also endometriosis, where there is tissue growing outside the uterine lining, outside the womb as well. It will also make it hard for fertilization to happen in a female. Fibroids. Now, for the fibroids, there are people that have fibroids and still get pregnant. I mean, this thing is, God, you know, this thing, everybody will tell you there are different case and different scenario about all these conditions. So some will tell you, oh, they have low sperm count and they were still able to give. Why some will tell you, oh, we've been trying to conceive, not able to conceive. Some women will tell you they have fibroids and they're able to conceive. Why some will tell you they're not able to conceive. So fibroids can be one, it can be in tiny it can be many and just very small. Some can be very, very large. This can also be a cause of female infertility. Then cervical mucus problem. When the mucus produced from the cervix is too thick and is not able to, and does not allow penetration of the sperm to fertilize the egg, it can also be an issue. So most times I tell women to also check your discharge, right? So when the discharge is becoming too thick and you feel like this is not the normal discharge, you can also watch it. What is going on? What is happening? Then age. You know, research has shown that women in their 30s. Did anyone see that video online? There was a controversial video online about someone that encouraged women in their 30s to freeze their eggs. Did you see that video? You know, I saw it on Instagram, and that person was telling women that once you are in the age of 30, she advised that you freeze your eggs. And that caused a lot of different conversations. Why should we freeze our egg? Why should we not freeze our egg? Why should they freeze their egg? And many women were everybody, and that's why in life everybody will have different things to say, and that's totally fine. And I think looking at that woman's perspective, she said hers based on how she felt. The female, how do I put it? Year in, year out, as we do menstruation, the number of egg reduce. That every female has like the estimated egg that comes with you with your childbirth, your everything as you grow up. And during menstruation, each one is being shared. Each one is being shared per month. And I think that's why she just felt like if you feel like you don't want to get married now, women have should I say a decline in fertility, and that's why she just recommended that people should freeze their eggs, and that caused a lot of different opinions. We cannot freeze, we should not freeze, we do not want to freeze. But research has shown that you might have had people saying women's biological clock, pardon me to say that, permit me to say that in Yoruba, and people will tell you that that's why it's good to give birth early. get married early, give birth early. Why that might be true, and I say I don't dismiss people's word, because everything people say is based on experience and based on what they've seen. Why, while that may be true, this does not happen for everyone. Some people are 40 years old and they still give birth. Some give birth at 45. Some give birth at 46, and they're ile as shoe, because 46 is quite not late, but compared to being in your 20s, 30s, and they still are able to conceive and give birth. So this thing just varies from woman to woman as well. But research has shown that women in their 30s, 40s have a declined fertility rate, which I am really struggling to believe, because I've seen people that are within that range and give birth. But I think I get the part of research. Research is just saying that, when people are young, they are more fertile compared to when they start getting old. I think that's what the research is trying to say. So age, and for the male as well. But I think male used to get to like 40s to 50s before there's a decline in their fertility rates. So age can also be a main factor of female infertility. Lifestyle: do not drink, do not smoke. It's not for the now, it's for the future. I love people that are not short-sighted. You have a vision. It means your eyes is seeing far. It's not just because of 2025, but you're seeing for the future as well. Do not drink, do not smoke, don't eat some certain food. Please do not do it, right? Obesity or underweight as well can be a main cause of female infertility. Excessive stress can trigger hormones, and then even during menstruation, you would hear people say when you are too stressed, um it might cause an imbalance. So your menstruation that is meant to come 3 days might come 1 week later, 2 weeks later. So excessive stress is not good. Do we have our men here tonight? Excessive stress is not good for the women. Women just want soft life. Well, I think everybody wants soft life, but we still have to go through stress. But I'm just saying, excessive stress that puts you on the brim of, I'm very stressed. It's not something we want the females or the males to go through. So it's not like I'm just gender biased. We don't want people to go through excessive stress as well. Then exposure to certain chemicals as well may also be a cause of female infertility. And there are many more. I'm just picking some points that I have to say tonight. There are many more factors that can predispose a male and female to infertility. But my point boils down to, when infertility occurs, I beg you, don't look at your wife like she's a witch, like she's the one that has things. In fact, if any male in this, a learned male in this current world, and you're experiencing infertility, in your family, and all you can say is blame the wife, shame on you. It means you are not a man. You're a transgender, right? Because no one should be, even a female as well. I mean, there should be no blames. Get yourself tested and know where the problem is coming from, and treat it and work on it. Like some women, maybe they are not able to conceive. That's why they bring in surrogacy, IVF, and different options for people as well. I mean, the main thing is just to get yourself tested so that you would know where you're going to, and you know the next thing for you and for your husband as well. And the last thing I'll talk about tonight is the lifestyle and behavioral factors. Very, very, very important. Lifestyle and behavioral. One thing that is mostly been neglected when it comes to marriage compatibility is about mental health. Your husband or your wife has to be physically, emotionally, spiritually, mentally, financially, psychologically, a lot of ali. They need to be stable. They need to be, because I've had people say, when I get married, I'll be happy. If you are not happy as a single person as you are, marriage will not make you happy, because marriage, I don't want to say marriage does not fulfill, but marriage makes you happy. But I mean, marriage is not just all that there is. So if as a single person you have mental health problem, when you enter the marriage, the problem will not go. So marriage does not hide things. In fact, marriage reveals things. It means if probably as a single you were managing yourself, when you get married, it will still show that this person has this thing. So I feel like people don't talk about mental health condition, which is very, very important. Talk about it. Talk about it. Let your partner know, or maybe for the mental health condition, maybe sometimes I get very aggressive. Now, you might think your being aggressive is normal because you're reacting to different situations. But if your aggressiveness or aggressive level is helping you to break bottle, it's not normal. Now, you as a female or male, we see that person breaking bottle while you were in a relationship and still say, let's go ahead, it will change. Is that not foolishness? That's suspending your thinking and just putting God. I mean, God is the most important. But some things that you yourself can see that these things are wrong. And now you just suspend your thinking and say, okay, let's just go into it. God will change his mind. But Leo, if God did not change his mind before he met you, it's after he met you and it's now with you that God wants to change his mind. So please talk about your mental health condition. Some people are walking on the streets. They are walking. You think they are normal. Until you have a conversation with them, you know that there is something wrong. This person is not normal. Talk about your mental health condition. Or maybe I have these anger issues. I mean, I'm in therapy. Maybe the person has bipolar disorders, anxiety, schizophrenia. Talk about it. Let your partner know. Oh, these things happen once in a while. I feel like I want to just punch the wall. Have you seen people like that? That just feel like I want to just punch the wall. And you might not know. Now, when you have a slight argument at home, they start punching. You start wondering, my baby was punching. Your baby has always been punching. You just didn't know. So please discuss with your partner if there are any pending mental health conditions that you need to talk about as well. Let them know maybe you have anxiety, maybe things makes you anxious. Right now, don't get me, there are times that we get anxious. But if your own is on another level, every time you just feel like you are gasping for breath because you are anxious, you cannot hold yourself together, discuss it. Right? Substance abuse. I beg you, and I believe that everyone listening to me and will say listening to me are learned people. When a partner is abusing a particular medication, now substance does not mean that it's just cocaine, codeine. Or I'm hearing new. I think hi. I'm hearing new things that I didn't even know before. I think someone was even saying urine. I think I had someone mention urine today. So substance does not just mean that they're taking hard drugs. Substance can also mean they can get addicted to medications like pentazocine. So you see, when someone is already addicted to a particular maybe medication, drug, and don't just say it will be fine, things will go well, we'll work on it, everything will go well. Discuss it as well. Discuss, because if you have someone that is dependent on a particular medication or drug, there can be problem in the future. Smoking, you know that someone is smoking, you know that you smoke, tell your partner, oh, I smoke. Then you will now work together. Okay, maybe you have to reduce it, don't smoke every time, don't do. So watch out for people. Don't say it's when you got married to you started smoking. Watch out for these different things in your partner or partner to be before you say yes to them. Diet and exercise. Some people know that they don't like exercise. Like, it's something that they know. I don't like to go to the gym. Now you get married to them and you're telling them, only you are getting too fat, go to the gym. And they don't like it. You guys didn't discuss. Okay, would you eat the gym? Are you a gym person or no? I mean, there are different things to discuss. So it's not like you are married and then your husband start calling you are too fat and then you start feeling bad. Discuss about your diet. The kind of food people want to eat, the kind of food you like to eat, you don't like to eat, or how you like to exercise, how you like to do this. Discuss about everything and talk about every pending mental health condition. Talk about the kind of children you want to give birth. Do you want one child, two child? Do you want there to be spacing? Do you think, I'm just, I know I'm talking about the medical part. Do you think we want one child, two child, three children? So it's not as if you get married and then you tell your wife you want 11. And she will say, I cannot give you 11. And then to lead to another argument. I mean, some things can be come to, you see, marriage is, I don't want to say it's transactional, but you must come to a level of agreement with whoever you are getting married to. This is how I want it to be. Okay, tell me how you envision. How do you want it to be as well? Are there anything going on with you that you think that I should know? I should come in. Do you understand? Discuss everything you can discuss with your partner before you get married to them. Do you think we want to stay in Nigeria? Do you think in the future we want to go abroad? Do you think now things changes in marriage? Now, there are times you might be married to a person and then this particular condition will just come up. That's fine. But now you are together. It's not as if it just happened. You are together and it happens. Now, you know how to navigate yourself from that particular aspect to ensuring that you still work together as a family and as one. But it's very important that all these tests are done before you say yes to anybody, before you get married to anybody, that you all discuss these things. Marriage is sweet, though, even if I'm not married, right? Marriage is sweet, I believe. But I also believe that marriage can be sweeter, not just with money in it, but with the right decisions and the right test that would save you both for financial problem in the future, arguments, breach of trust, and different things that can also come up in the future as well. And I think with this, I have discussed in depth all that there is to know about medical compatibility when it comes to marriage. So it's not just I love him, I love her, he has good eyes, he has good nose. You know, I was talking to someone, or I think I spoke to someone, and then the person asked me, do I like to smoke? I look back because I look at myself. Do I look like someone that like to smoke? I was surprised. And then it was just like, do you not like to get high sometimes? And I'm like, get high sometimes. So it means that that kind of person would like to get high sometimes. Now, they might not tell you that they would like to get high sometimes, but in your conversation, ask people, do you drink? Do you smoke? Don't let anyone feel like you're asking too much. Because for someone to ask me, do I not like to get high? It means that they like to get high. So now I know that from our conversation, this kind of person, we can't, because I'm not a high person, and that person might be a high person, so we cannot be together. Do you understand me? So discuss with people, get to know things that are going on, get to understand people's perspective, how you want to live. I feel like this is what I want to do. But just get to know and get to establish and get to work on every information that you have. Nobody builds a new behavior, right? Everything is a hidden one that is being, because marriage will always review things. And medically, do those tests, get tested, and also know what it is that you have to do as well. I hope that with tonight's slide, I've been able to discuss different things with everyone, and I believe that you understand what marriage compatibility means now, because I believe that I discussed, and to an extent you understand. Before I say I do the different tests you have to do, you also know how to be very sincere and complain with your partner as well, and discuss things with them, both pending, unpending, and just be very open with everyone to actually help your marriage, strengthen your marriage, and save your marriage as well. All right, thank you so much. Now it's time for questions. Do we have any questions tonight? Are there any questions? Is there anything you love to clarify? You love to understand? You love me to shed more light on? You love to know as well? I would love to take questions now. Are there any questions concerning medical marriage compatibility? And if you are married, don't get me wrong, if you are married and you just find out that maybe your partner has different things going on, that should not destroy the marriage. Just work together, because marriage is for better, for worse, right? Work together and just plan how you want to live together and keep on moving together. So, and I just pray for everyone that you'll find the bone of your bone, the flesh of your flesh, the man that will love you just as God loves you, and the man that you will do forever with, in love, peace, joy, harmony, and much money, with blessings of children as well. Amen. Thank you so much for joining. Are there any questions before we call it tonight? If there are no questions, I think we'll call it tonight. Thank you so much for joining. It's always amazing when people join the sessions that I have. Thank you. For if you are a returning joiner, if you are a returning subscriber and joiner of the live sessions, I say a big thank you. Thank you for always being here. Thank you for always participating. Thank you for everyone that shares my link, everyone that put out my link to people to see. God bless you. May men honor you. May men arise on your behalf. May you find people on the side of men as well. I appreciate you. I'm very grateful. And if you're able to subscribe to my YouTube channel, please click on the red button below so you can subscribe and get notified whenever I post a new video, or whenever I post any notifications that will take place on the YouTube platform, El Talk with Kemi. And great news, next week, 27th June 2025, I will be, not I will. I have an amazing panel all lined up for students, corpers, um, graduates, fresh graduates, old graduates, final year students, if as long as you're in school. I have a live Beyond School conference coming up, and I've packed an amazing panel that will discuss with people what you should know beyond school, what the teachers is within school. Now, beyond school, there's an under life entirely that you need to know, be aware of, and work towards. And I cannot wait to have you on board. The link will be posted as well, so you get to see it. And please invite people and get ready. It's going to be amazing, amazing next week. Thank you, everyone, for joining. God bless you, and I will see you next week. All right. I still see two people connected. Can you just say bye-bye? Bye-bye. Thank you for joining tonight. Thank you so much. The link will be posted so you can watch the replay as well if you need to watch the replay. Thank you so much. Have an amazing night's rest. All right. Bye-bye, everyone. Thank you so much. Good night. Mwah, mwah. Bye.